Welcome back, everyone. Today, we're doing a deep dive into newborn assessment and care.
Oh, exciting.
We've got all your sources right here, and we're going to pull out the need-to-know info for your fundamental nursing courses.
Definitely important stuff.
I know those textbooks can be a little dry.
Oh, yeah.
So we're going to break it all down into those little nuggets that will help you not only ace your exams,
For sure.
but really impress your instructors on those clinical rotations.
That's the goal.
And what I think is so fascinating is that newborn care, it's not just about the medical side of things.
Right.
It's about understanding this incredible journey that these tiny humans have just gone through.
Absolutely.
And then supporting these families as they go through this huge transition.
100%. It's this delicate balance between, physiology and emotion.
Yeah.
And nurses are right at the heart of it all.
We are. So let's start by talking about that immediate newborn period.
Okay.
Those first few hours after birth.
Yeah.
It's a time of intense adaptation for the newborn, right?
It really is. Imagine all these systems that have been, happily functioning inside the womb.
Right.
And then suddenly they have to work independently.
It's a big adjustment.
It is. Temperature regulation, breathing, circulation. It's a lot to handle all at once.
It's like they're thrown in the deep end of the pool.
Exactly.
So what are some of the biggest concerns during this transition period? What should we as nurses be really watching for?
Well, one of the most critical things is to look for any signs of respiratory distress.
Okay.
Remember, these babies have been breathing fluid,
Right.
not air, right? So their lungs are still adapting. Things like nasal flaring, retractions, where you can actually see their chest sinking in with each breath and grunting. These are all warning signs.
Got it. And then, of course, temperature regulation.
Oh, absolutely.
Newborns are just notorious for losing heat quickly.
Especially if they're wet or exposed.
Exactly.
That's why we're so meticulous about drying them off immediately after birth and keeping them nice and warm.
It's like they don't know how to work their internal thermostat yet.
Not quite.
But speaking of assessing those early signs, let's talk about the Apgar score.
Okay.
I know it's one of the first things we learn in nursing school,
It is.
but it's so much more than just a number.
You're absolutely right. The Apgar score is really a brilliant system
It is.
for quickly gauging a newborn's, overall vitality at birth.
Right.
It gives us a snapshot of how well they're handling that transition to extra-uterine life.
Yeah.
We assess 5 key areas: heart rate, respiratory effort, muscle tone, reflex irritability, and color.
Yeah.
And we score them at 1 and 5 minutes after birth.
No, what's interesting is that a lot of people think the Apgar is like a one and done
Right, they do.
assessment, but it can actually be used as a guide throughout that whole early transition period, right?
Absolutely. If a baby's having trouble stabilizing, we can keep doing Apgar scores to track their progress.
So it's like we're getting these little check-ins
Exactly.
to see how they're doing.
It helps us paint a more dynamic picture of how the baby's adapting.
Yeah, I like that. Okay, let's move on to those adorable newborn measurements. I can already see those proud parents like beaming as we record their little one's length and weight.
Oh, absolutely. But those measurements are, they're more than just sentimental keepsakes.
Right.
They're really important indicators of fetal growth, and they can give us clues about potential problems.
So for example, when we're measuring length,
Yeah,
it's really important to make sure that the baby's leg is fully extended.
absolutely. Otherwise, you're going to get an inaccurate measurement.
And head circumference is another measurement that can give us a lot of valuable information.
Speaking of head circumference, I remember learning that it should roughly equal the chest circumference by the time a baby is 1 year old.
You've got a great memory.
Oh, thanks.
That's exactly right.
Yeah.
And that's why it's so important to measure head circumference accurately in those early months.
It can help us detect issues like microcephaly,
Right.
where the head is smaller than expected, or hydrocephalus, where there's a buildup of fluid in the brain.
So even those seemingly like routine measurements
Yeah,
are really powerful tools for early detection.
100%.
Now, what about vital signs?
Okay.
We're basically getting a real-time update on how this baby's doing, right?
Exactly. Vital signs are like, a window into how those tiny organs are functioning.
Yeah.
In those first few hours, we're checking their heart rate, respiratory rate every 30 minutes until they stabilize,
Yep.
and then every 8 hours after that. And I'm sure you'll be happy to hear that rectal temperatures are no longer the standard of care.
Wait, really?
Yeah.
I thought we always did rectal temps on newborns.
Not anymore.
Okay.
We've switched to axillary temperatures,
Oh.
which are just as accurate and so much safer.
Okay.
It eliminates the risk of rectal perforation, which can be a very serious complication.
That's a huge relief. I know I was always a little nervous about doing rectal temps on those tiny babies.
I get it.
So let's move on to skin assessment. I'm guessing there's more to it than just, like, checking the color.
Oh, so much more. The skin is like a roadmap,
Okay.
to the newborn's overall health. For instance, checking skin turgor.
Okay.
How quickly the skin snaps back after being pinched can tell us a lot about their hydration status.
Okay.
If the skin tense or stays pinched, it could signal dehydration.
Got it. And then, of course, we have those adorable newborn skin variations.
Oh, I love those.
It's amazing how many different marks and rashes can show up in those first few days.
I know. It's like a whole new vocabulary of skin conditions to learn.
It really is.
And some of them can look pretty alarming to parents.
I bet.
But most are completely harmless.
Right.
And it's our job to educate parents about those variations and reassure them that, most of them will disappear on their own.
It's all about that education, right? Knowledge is power. And for new parents especially,
Oh, yeah.
knowing what's normal and what's not can make all the difference.
For sure.
So let's talk about some of these common skin variations that we might see.
Okay.
One that I know always catches parents' attention is erythema coxicum,
Yes.
also known as newborn rash.
Mm-hmm.
It's those little red bumps and pustules that can pop up anywhere on the body.
It can look a bit like baby acne,
Right.
but it's actually an inflammatory response not related to hormones.
And it usually disappears within a week or so, right?
Exactly. No treatment is necessary, just reassurance and gentle cleansing.
Okay, good to know. Another common variation is Mongolian spots,
Oh, yes.
which are those flat, bluish-gray patches
Mm-hmm.
that often appear on the lower back or buttocks.
Right. More common in babies with darker skin tones.
Okay.
And they're caused by pigment cells that haven't migrated to the surface of the skin.
They kind of sound like bruises,
They do.
but they're not painful at all, are they?
Not at all. They usually fade over time, often by the time the child reaches school age.
Okay. And then there are the vascular birthmarks like nevus flammeus,
Yeah.
also known as a port wine stain, and nevus vasculosus, or the strawberry mark.
Mm-hmm. Those are caused by an overgrowth of blood vessels in the skin.
And those are the ones that sometimes can look a little concerning, right?
Yes, they can be quite prominent, especially the strawberry marks,
Oh, yeah.
which tend to grow rapidly in those first few months of life. But most of them are benign and don't require treatment.
Okay.
However, it's important to note their location and size,
Right.
because some vascular birthmarks, especially those on the face, can have implications for underlying conditions.
So it's all about careful observation
Exactly.
and documentation, even with those seemingly harmless skin variations.
Oh, sure.
Speaking of things that can look a little alarming, let's talk about some of those head-shaped variations that we see in newborns.
Right.
Because babies don't always come out with those perfectly round heads
They don't.
that we see in the baby books.
No.
Molding, where the head kind of elongates to fit through the birth canal, is super common.
Extremely common.
And it usually resolves pretty quickly, right?
Absolutely. Within a few days, that elongated shape will round out on its own.
Okay, good. But there are a couple of other head swellings
Yeah.
that we need to be able to tell apart.
Right.
Caput succedaneum
Yes.
and cephalometoma.
Okay.
And I know those sound kind of intimidating.
They do.
What's the difference between the two?
Well, they're both caused by pressure on the baby's head during labor and delivery, but there are some key distinctions. Caput succedaneum is basically swelling of the scalp.
Okay.
It's soft and puffy, and it can cross suture lines.
So it's kind of like a fluid-filled cap
That's a great way to visualize it.
sitting on top of the head.
Yeah, okay.
Cephalometoma, on the other hand, is a collection of blood between the skull bone and its covering called the periosteum.
Okay.
It feels firmer than caput, and it doesn't cross suture lines.
Okay, so one is fluid,
Mhm.
the other one's blood.
Yeah.
Okay. That makes sense. But how can we tell them apart visually?
Okay, so think of it this way. Caput succedaneum is like a soft, puffy cap.
Okay.
Might have some bruising.
Okay.
Cephalometoma is more defined,
Okay.
like a bump, and it doesn't cross suture lines.
Got it. And what's interesting is that cephalometoma can sometimes lead to jaundice, right?
It can, yes.
As that blood breaks down.
Exactly.
So even those seemingly like minor head variations can have bigger implications.
They can.
Really shows how important a thorough assessment is.
Absolutely.
Now let's talk about fontanelles.
Okay.
Those soft spots,
Mm.
they seem so delicate.
They are, but they serve a vital purpose.
Okay.
They allow the baby's head to mold during birth
Right.
and accommodate all that incredible brain growth that happens in the first year of life.
That's right.
When you're palpating them, they should feel soft and slightly indented. But if they're abnormally large or small, it could signal a developmental issue.
So those soft spots are actually giving us some hard data
That's a great way to put it.
about this baby's health.
Exactly.
So what would cause a fontanelle to be abnormally large or small? Well, a large fontanelle might indicate malnutrition
Okay.
or hydrocephalus, while a small or closed fontanelle could point to craniosynostosis,
Okay.
which is where the bones in the skull fuse prematurely.
So much information we can get just from feeling those fontanelles.
I know.
Okay, let's move on to the mouth and the eyes.
Oh, right.
And I'm guessing there's more to assess than just, are they there?
You got it. In the mouth, besides the obvious abnormalities like cleft lip or palate, we're also looking for subtle clues. For instance, a thin upper lip can be a sign of fetal alcohol syndrome.
Okay.
And with the eyes, we need to remember that newborns have immature eye muscle control.
Right.
So you might see some transient strabismus.
Oh, right. That's where their eyes seem to wander.
Exactly. And you might also see some nystagmus, which are those involuntary, jerky eye movements.
Okay.
But a key assessment here is the red reflex test.
Right.
It should be present in both eyes.
Yeah.
And any dullness or irregularities would warrant further investigation.
Okay, noting that down. Now, ears and clavicles. These might not always get as much attention, but they're still important, right?
They are. When we're assessing the ears, we're looking for low-set or abnormally shaped ears, which can be associated with syndromes or even kidney problems.
Wow.
And early hearing screening is just crucial for language and cognitive development.
Right. The sooner we can catch any issues, the better.
Absolutely. The better the outcomes.
And what about the clavicles? I feel like those are kind of an odd thing to focus on.
You'd be surprised how often they're fractured during birth.
Oh, really?
Especially in larger babies.
Okay.
Or those delivered with vacuum extraction.
Okay.
So always check for any signs of a fracture, edema, crepitus, limited movement.
Got it. Making a mental note to pay attention to those clavicles.
Good plan.
Now, onto the chest and abdomen. I feel like we're getting into the more than meets the eye part of the exam.
You're right. The newborn chest should have that characteristic barrel shape. And you might notice a prominent xiphoid process, which is that little bony protrusion at the bottom of the breastbone.
Okay.
And get this, engorged nipples and milky discharge are totally normal in both sexes.
Wait, really?
Yep. It's all thanks to those maternal hormones.
Interesting.
Just reassure parents that it's temporary. You might also see supernumerary nipples,
What's that?
extra nipples.
Okay.
They're usually harmless, but it's worth mentioning to the parents.
Okay, that one is going in my fun facts to impress my classmates folder.
I love it.
Now, what about the abdomen?
Okay, so the abdomen's normally protuberant
Okay.
because of those immature abdominal muscles. So
Okay.
when you're auscultating bowel sounds, listen for anything abnormal, absent, or hyperactive sounds could indicate an obstruction.
So even in a seemingly straightforward area,
Right.
like the abdomen,
Yeah,
there could be a hidden problem.
absolutely.
It really makes you appreciate how important a thorough assessment is.
100%.
And speaking of things that might not be immediately obvious, it's this. Let's talk about umbilical cord care.
Right.
I've heard there's some new evidence on this.
There is. A recent systematic review found that applying breast milk to the cord can actually speed up the time it takes to separate and might even reduce the risk of infection.
Wow, so breast milk is good for more than just feeding.
It is.
So what should we be telling parents about this new approach?
Well, emphasize good hand hygiene before expressing any breast milk.
Okay.
And then just a few drops applied to the cord stump.
Okay.
Let it air dry.
Okay.
It's a really simple,
Right.
safe, and effective alternative to dry cord care.
Good advice. Now, speaking of parental decisions, let's talk about something that often sparks debate.
All right.
Circumcision.
Yeah,
There are so many factors that influence this decision,
there are.
and it's our job to support parents no matter what they choose.
Absolutely. It's crucial to provide unbiased information about the procedure,
Right.
the risks and benefits,
Yeah.
and the different methods used. Ultimately, it's the parent's decision, and we need to respect that.
And regardless of their decision, we need to be prepared to provide the appropriate care, right?
Exactly. If the baby is circumcised, we're monitoring for bleeding, documenting voiding, and teaching parents about those specific cleaning techniques.
Right.
If the baby's uncircumcised, we're emphasizing gentle cleansing and explaining that the foreskin will retract naturally over time.
It's all about empowering parents with that knowledge
Yes.
and supporting their choices.
100%.
Now, on to a topic that's always top of mind, newborn safety.
Okay.
These tiny humans are just so vulnerable.
They are, and it's a shared responsibility.
Yeah.
Nurses, parents, everyone. You won't believe this.
What?
But there was actually a case where a woman posing as a nurse abducted a newborn from the hospital.
Oh my goodness.
I know, crazy, right?
So what can we do to prevent these unthinkable situations?
Well, that specific case led to hospitals implementing stricter security measures.
Okay.
Like electronic baby tagging systems.
Oh, good.
But we also need to educate parents about the tactics abductors use. Like, for example, never let anyone without proper identification take their baby.
Right.
And always keep the baby within the sight.
Okay, that's really scary to think about.
It is, but being aware is half the battle.
Yeah, definitely. And speaking of safety essentials, car seats are non-negotiable.
Oh, absolutely. Sadly, car accidents are a leading cause of injury and death in infants.
Yeah.
And often it's because they're not properly restrained.
Right.
The guidelines are clear. Choose a car seat that's appropriate for the baby's size and weight.
Right.
Install it correctly,
Mm-hmm.
and keep it rear-facing until at least age 2.
It's so much to remember.
It is.
It really hits home how important that discharge teaching is
Oh, for sure.
for these new parents.
Absolutely.
And don't forget about infection prevention.
Right.
Newborns are especially susceptible to infections.
They are.
So hand hygiene is like paramount.
Absolutely. For everyone coming into contact with the baby, it's like we're all on the same team working together to keep this little one healthy.
Exactly. So what else can we do to prevent infection in the newborn nursery?
Well, aside from that meticulous hand hygiene, we also want to minimize exposure to potential pathogens.
Right.
So that means limiting visitors, especially anyone who's sick,
Right.
and avoiding shared supplies.
Okay.
And of course, we're constantly monitoring for any signs of infection, especially at the umbilical cord and circumcision sites.
Yeah, early detection is key.
Absolutely.
Now let's talk about sleep.
All right.
I know a lot of new parents are sleep deprived,
They are.
and they're worried about their baby's sleep habit.
Understandably.
So what's the reality of newborn sleep?
Well, first, let's dispel the myth that newborns sleep through the night.
Okay.
You know, their tiny stomachs need those frequent feedings.
Right.
So expect lots of waking, even during the night. But what we can do is help parents create a safe sleep environment
Okay.
that reduces the risk of sleep dynes.
Yeah, the Safe to Sleep campaign has done wonders
It has.
for raising awareness about safe sleep practices.
Absolutely.
So we know back sleeping is crucial.
Always place the baby on their back for naps and nighttime sleep.
Okay.
And room sharing is recommended, but not bed sharing.
So baby in the room, but in their own safe sleep space.
Exactly.
What other advice would you give parents about creating a safe sleep environment?
You know, think bare is best when it comes to the crib.
Okay.
No loose bedding, pillows, bumpers, or stuffed animals.
Right.
And while it can be tempting to bundle them up, avoid over-swaddling.
It's about finding that balance,
Yeah.
right? Between warmth and safety.
Exactly.
Now, what about soothing techniques?
Okay.
Because, let's face it, all babies cry.
Oh, they do.
And sometimes it feels impossible to calm them down.
It can feel that way. But it's a universal experience, and we've got some practical tips.
Okay, good.
First, rule out any basic needs. Are they hungry?
Right.
Wet? Uncomfortable? Then try things like feeding, burping, gentle touch, rocking, white noise, swaddling.
Oh, so many options. It's good to have like a whole toolkit of soothing techniques.
Exactly. And don't underestimate the power of a simple swaddle.
Right?
It can work wonders for some babies.
Yeah.
Just make sure the head is exposed and the swaddle isn't too tight.
Okay, noting that down. Now, on to something that's truly a public health triumph, those newborn screening tests.
Yes.
It's amazing that we can identify potential problems so early on.
It is. These tests are like a safety net, you know?
Okay.
Catching conditions that might not be obvious at birth.
Yeah.
We're talking genetic and metabolic disorders,
Right.
as well as hearing loss.
So we're looking for those hidden risks
Exactly.
that could have serious consequences if they're not addressed.
Exactly.
So what are some of the specific conditions that these tests screen for?
Well, the specifics vary by state,
Okay.
but some of the most common ones are PKU, hypothyroidism, galactosemia, and sickle cell disease. And remember, early intervention is key. The sooner we address these issues, the better the outcomes for the baby.
Yeah, it's so powerful to think that a simple blood test can make such a huge difference in a baby's life.
It really can.
And speaking of crucial screening, let's talk about hearing screening.
Okay.
It's often overlooked, but hearing loss is actually one of the most common birth disorders.
It is, but the good news is
That's that.
Universal screening is now standard practice.
That's great.
Every newborn gets tested before they leave the hospital.
So we're not just relying on parents to notice those subtle signs.
No, it's a proactive approach, catching those issues early on.
I like that. What are the different methods used for hearing screening?
There are two main ones: otoacoustic emissions, or OAE,
Okay.
and automated auditory brainstem response, ABR.
Right.
OAE measures sounds produced by the inner ear,
Okay.
while ABR looks at neural activity in the brainstem in response to sound.
Got it. So they're both looking at different parts of the hearing pathway.
Exactly.
So if a baby doesn't pass that initial screening, what happens next?
They're referred for further evaluation by an audiologist.
All right. And it's important to emphasize that even if a baby passes the initial screening, it doesn't guarantee perfect hearing.
Right.
Ongoing monitoring and follow-up care are important.
So it's just the first step
Exactly.
in making sure that this baby's hearing is developing appropriately.
Exactly. It's all about that continuum of care.
Okay, so let's move on to some common concerns that can arise during the newborn period.
Right.
Let's start with transient tachypnea of the newborn,
Okay.
or TTN.
TTN.
I know that one always sounds a bit alarming.
It can sound a bit scary, but it's actually a fairly common and usually benign condition.
Okay.
It happens when there's a delay in the clearing of fluid from the baby's lungs after birth.
So they're still holding on to some of that amniotic fluid.
Exactly. And that extra fluid in the lungs can make it harder for them to breathe,
Right.
leading to symptoms like rapid breathing, retractions, grunting,
Right.
and even a bluish tinge to the skin, which we call cyanosis.
It sounds like it can be pretty distressing
It can be.
for both the baby and the parents. But the good news is that TTN usually resolves on its own within a few days.
Okay.
While the baby is recovering, we provide supportive care,
Okay.
like supplemental oxygen and close monitoring.
And lots of reassurance for those parents, I'm sure.
Oh, for sure.
Speaking of things that can cause parental anxiety, let's talk about physiologic jaundice.
Okay.
That yellow tinge to the skin
Mm-hmm.
can be kind of startling, even though it's so common.
It is common. You know, it's estimated that around 60% of full-term babies and 80% of preemies develop jaundice in that first week of life.
Wow, those are higher numbers than I would have thought.
Yeah.
So what exactly causes this yellow hue?
Well, it all comes down to bilirubin,
Okay.
which is a yellow pigment that's produced when red blood cells break down.
Right.
In newborns, the liver is still immature
Okay.
and might not be able to process bilirubin as efficiently,
Got it.
leading to a buildup in the blood.
Right.
And that characteristic yellowing of the skin and whites of the eyes.
So it's like an overload of bilirubin
That's a great way to put it.
that the baby system can't quite handle yet.
Exactly.
Now, most cases of physiologic jaundice are mild and resolve on their own as the liver matures.
They do, but
It's a-
if the bilirubin levels get too high,
Yeah.
it can lead to a serious condition called kernicterus,
Right.
which can cause brain damage.
So it's important for us to be monitoring those bilirubin levels really closely.
Absolutely. And we do have treatments like phototherapy to help break down bilirubin if needed.
And you mentioned earlier that phototherapy has a fascinating history.
Oh, it does.
Didn't it originate from a nurse's observation?
You've got a great memory. Back in the 1950s, a nurse in England noticed that babies who were exposed to sunlight seemed to have less jaundice. And that simple observation sparked the development of phototherapy as we know it today.
That's amazing.
It is.
That something as simple as sunlight
Yeah.
can lead to such an impactful treatment.
It's a reminder that nurses are constantly making observations, asking questions,
Yeah.
which can lead to these incredible breakthroughs in patient care.
So true. Let's talk about another potential concern in newborns. Hypoglycemia, or low blood sugar.
Okay.
Hypoglycemia can be tricky because sometimes there aren't really any obvious symptoms,
Right.
but it's something we need to be very aware of,
Absolutely.
especially in those first few hours of life.
Yes.
So why are newborns so susceptible to hypoglycemia?
Well, they have limited glucose stores,
Really?
and they're going through so many metabolic changes after birth.
Right.
So their blood sugar can fluctuate quite a bit.
So it's like a vulnerable time for them, metabolically speaking.
Exactly. And while most babies experience transient hypoglycemia without any problems,
Okay.
some are at higher risk.
Okay. So who are those babies?
Like babies born to mothers with diabetes, preterm babies, and babies with IUGR, which stands for intrauterine growth restriction.
So we need to be extra careful with those little ones.
Absolutely.
So what are some signs of hypoglycemia that we should be watching for?
Sometimes there aren't any obvious signs.
Oh, okay. That some babies might be jittery, lethargic, have difficulty feeding,
Okay.
or even experience seizures.
Okay.
If we suspect hypoglycemia, we can check their blood sugar level with a heel stick.
And how do we treat hypoglycemia in newborns?
Well, early and frequent feedings are key,
Okay.
whether it's breast milk or formula.
Okay.
For babies at higher risk, we might need to monitor their blood sugar levels more closely
Okay.
and provide intravenous glucose if necessary.
So it really is a team effort.
Oh, it is.
That's right. Nurses, doctors, and parents all working together to keep these babies safe and healthy.
You got it.
And that brings us to a topic that's, fundamental to newborn well-being nutrition.
Right.
We've talked about feeding and the different choices that parents make.
Yeah, those tiny tummies are fueling some serious growth and development.
They are. And newborns have some unique nutritional needs
Right.
that we really need to understand and address.
It's not just about what they're eating.
Right.
It's also about how their bodies are processing those nutrients. Exactly. Newborns, they have tiny stomachs,
Yeah.
immature digestive systems,
Yeah.
developing immune systems.
Right.
All these factors influence
Mm.
how often they need to eat, how much they can eat at a time,
Exactly.
and what types of foods they can tolerate.
It's a lot to consider.
It is. So what are some kind of key things that we need to keep in mind when we're thinking about newborn nutrition?
Well, first and foremost, frequent small feedings are essential in the beginning.
Okay.
As the baby grows, we gradually increase the volume of each feeding.
That makes sense.
We also need to be mindful of potential food allergies, especially in those first few months of life.
Right.
But overall, whether a baby is breastfed or formula fed, we want to make sure they're getting the right balance of nutrients to support their growth and development.
And I think it's important to reiterate
Yeah,
that the decision of how to feed a baby is a very personal one.
it is.
Our role as nurses is to provide parents with evidence-based information and really support them in making the choice that's right for their family.
We're not here to judge, just to empower parents with knowledge and help them feel confident in their choices.
Exactly. So let's talk about those choices in more detail, starting with breastfeeding, which is often referred to as nature's perfect food.
And for good reason. Breast milk is truly an amazing substance. It provides all the nutrients a baby needs in the right proportions, and it's easily digestible.
Right.
Plus, it contains antibodies and other immune factors that help protect babies from infections and diseases. There's even evidence to suggest that breastfeeding can lower a baby's risk of developing certain chronic conditions later in life.
It's almost like breast milk is tailored to meet the baby's every need.
It really is. But we also need to acknowledge that not all mothers are able to or choose to breastfeed.
Right.
And that's perfectly okay.
Absolutely.
There are many excellent formulas available that meet babies' nutritional needs.
So it's all about making sure the baby is getting the nourishment they need,
Yeah.
regardless of the source.
You got it. And for those mothers who do choose to breastfeed, there's a lot we can do to support them on that journey. It's not always easy, and many moms experience challenges along the way.
Absolutely.
Yeah.
That's where our nursing skills and knowledge really come into play.
Right.
We can help mothers with positioning, latch techniques,
Yeah.
and really troubleshooting common breastfeeding problems like sore nipples and engorgement.
And let's not forget about the emotional support that's so crucial during this time.
Yeah, that's so important.
Breastfeeding can be a beautiful bonding experience, but it can also be stressful and overwhelming.
Oh, absolutely.
We want to create a supported and encouraging environment for those breastfeeding mothers.
And for mothers who choose to formula feed,
Yeah,
we can help them navigate the different types of formula,
absolutely.
preparation methods, safety precautions.
It's all about providing parents with the information and resources they need to make those informed decisions and feel confident in their feeding choices.
You know, one thing that often gets overlooked in all the excitement of, like, welcoming a new baby
Yeah.
is the importance of preparing for discharge.
It's a huge transition for families.
It is.
And we want to make sure they feel equipped to handle life at home with their new little one.
Absolutely. Discharge teaching is crucial. It's our chance to really empower parents with knowledge and skills to help them care for their baby safely and confidently.
And it's not just about handing them a stack of pamphlets.
No, definitely not.
We need to assess their individual needs and tailor our teaching accordingly.
It's about creating a supportive learning environment
Yeah.
where parents feel comfortable asking questions, sharing their concerns.
Exactly. And we need to cover a wide range of topics, from the basics of feeding and diapering to more complex issues like recognizing signs of illness and knowing when to seek medical attention.
There's a lot to cover.
It is a lot to cover in a short amount of time.
So what are some of the key things that we should really focus on during that discharge teaching?
Well, I always like to start with the basics. How to hold and handle the baby safely, how to bathe them, how to change diapers, and how to soothe a crying baby.
Makes sense.
Then we move on to feeding, whether it's breastfeeding or formula feeding.
Okay.
We cover the different positions, techniques, and potential problems that might arise.
Right. And of course, we have to emphasize safe sleep practices.
Oh, absolutely. We talk about placing the baby on their back to sleep, using a firm mattress with a fitted sheet, and keeping the crib free of loose blankets, pillows, and toys.
It's amazing how much there is to learn
It is.
about caring for a newborn.
There is.
And we also need to cover things like umbilical cord care, circumcision care, if applicable,
Right.
and how to take the baby's temperature.
Yes.
And we always emphasize the importance of following up with the pediatrician for well baby checkups and vaccinations.
Absolutely.
Now, speaking of those follow-up appointments, what's the typical schedule for well baby checkups?
The first follow-up appointment usually happens within a few days of discharge, and then there are regular checkups scheduled throughout the first year of life.
Okay.
These visits allow the pediatrician to monitor the baby's growth and development, administer vaccinations, and address any concerns the parents might have.
And what are some of those red flags
Yeah.
that we should tell parents to watch for?
Things like fever, forceful vomiting, refusal to feed, infrequent wet diapers, lethargy, difficulty breathing. These are all signs that something might be wrong and the baby needs to be seen by a doctor right away.
So we're not just teaching parents how to care for their baby,
Right.
but we're also empowering them to trust their instincts
Yes.
and to seek help when they need it.
Exactly. We want them to feel confident in their ability to care for their baby, but also to know that they're not alone and there's always help available.
And speaking of help, let's wrap up our discussion with a topic that's, near and dear to our hearts. Immunization.
Oh, yes. Vaccines are truly one of the most important things we can do to protect babies from preventable diseases. It's a public health miracle that we have these tools at our disposal.
And yet there's still so much misinformation circulating about vaccines.
It's frustrating.
It is. Our job as nurses is to provide parents with accurate, evidence-based information about vaccines so they can make informed decisions for their children.
Absolutely.
So what are some key points that we should really emphasize when we're talking to parents about vaccines?
Well, first and foremost, we want to stress that vaccines are safe and effective.
All right.
They undergo rigorous testing and safety protocols before they're approved for use.
Yeah.
And the benefits of vaccination far outweigh the risks.
And we also need to address those common concerns about vaccine side effects.
Exactly. Most side effects are mild and temporary, like soreness at the injection site, low-grade fever, or fussiness.
Right. And it's important to emphasize that vaccines do not cause autism.
Absolutely. That's a myth that's been debunked time and time again, but unfortunately persists.
It does.
We need to be prepared to address parents' concerns with empathy and accurate information.
And sometimes that can be tough.
It can.
But we're not just educators.
No.
They're advocates for vaccination.
We are. We need to be champions for these tiny humans and their right to a healthy start in life.
Thinking back on all that we've covered today, from those first moments after birth to sending those little ones home with their families, it's incredible to think about the journey that we get to witness as newborn nurses.
It really is a privilege to be a part of such a special time in a family's life.
It is.
And we have the opportunity to make a profound difference in the health and well-being of these tiny humans.
It's a challenging but incredibly rewarding field.
It is.
And we're excited to see all that you, our listeners, will accomplish as you embark on your nursing careers.
We are.
Now, as we wrap up this deep dive, we'd love to hear from you. What surprised you the most about what we discussed? What areas would you like to explore further as you continue learning about newborn care? Your questions and insights help us all learn and grow. So stay curious, stay compassionate, and keep learning. Wow, we really covered a lot of ground today.
We did. It really is amazing to think about all those little details that go into newborn care.
Yeah, it's like we zoomed in on each system, each assessment, but now I'm seeing how they all connect to form this bigger picture of caring for this brand new human.
That's what's so fascinating about newborn nursing. It's not just checking boxes. It's recognizing those subtle cues, understanding the physiology, anticipating potential problems.
It takes so much critical thinking.
It does.
It's not just memorizing the facts. It's applying that knowledge to these real-world situations.
Exactly, and that's what makes it so challenging and rewarding.
It is.
You know, we're constantly learning, we're growing, we're adapting our skills to meet the needs of each baby and family.
And speaking of families, let's talk about cultural sensitivity for a second. You know, newborn care practices can vary so widely.
They do.
Based on cultural beliefs and tradition.
Absolutely. We need to be respectful of those differences and tailor our approach.
It's not a one-size-fits-all.
No, not at all.
So give me an example. How might cultural beliefs kind of influence newborn care?
Well, some cultures might have, specific beliefs about umbilical cord care.
Okay.
For instance, some might prefer to use traditional remedies or herbs instead of the standard antiseptic solutions.
Interesting.
Others might have different beliefs about breastfeeding practices, like when to introduce solids or how long to breastfeed.
So it's about being open-minded.
Yeah.
And willing to learn from these families that we're caring for.
Exactly. And it all comes back to communication.
It's communication.
Open, honest, and non-judgmental communication. We need to be active listeners, asking questions, and really seeking to understand the family's perspective.
It's about building a partnership with them.
Yes.
Not just telling them what to do.
100%. And, becoming a parent is a huge transition.
It is.
Even the most prepared parents can feel overwhelmed at times.
For sure.
And it's our job to provide that reassurance and support.
Absolutely. And sometimes that means setting aside our own assumptions.
Right.
Our own biases.
Yes.
And really meeting the family where they are.
That's so important. We need to be mindful of our own cultural lens and avoid imposing our beliefs on others.
So what does this all mean for you, our amazing listeners? We've explored so much information today, but the key takeaway is this. Knowledge is power.
It is.
The more you understand about newborn assessment and care, the better equipped you'll be to provide exceptional nursing care.
And remember, this is just the beginning of your nursing journey. There's always more to learn, new discoveries to be made, and countless opportunities to make a difference in the lives of your tiny patients and their families.
So as you move forward, remember to stay curious, stay compassionate, and always keep learning. We're so excited to see all the amazing things you'll accomplish as newborn nurses. Thanks for joining us on The Deep Dive.